Welcome to the video. Test your nursing knowledge and pass your NCLEX exam. This covers everything from medical surgical nursing to maternity. Now, let's get started. The nurse is caring for clients in outpatient surgery. The mother of a 4-year-old asks the nurse how to prepare her daughter for eye surgery. Which of the following statements by the nurse is best? 1. Draw a picture of the eye to explain what will happen. 2. Tell your daughter that the procedure will take 1 hour. 3. Use dolls or puppets to explain how to get ready for surgery. 4. Read an age-appropriate illustrated book about eye surgery to your daughter. The answer is 3. Correct. Use puppet or doll to show where procedure is performed. Explain procedure in simple terms and what the child will see, hear, taste, smell, and feel. A 23-year-old woman at 32 weeks gestation is seen in the outpatient clinic. Which of the following findings, if assessed by the nurse, would indicate a possible complication? 1. The client's urine test is positive for glucose and acetone. 2. The client has 1+ pedal edema in both feet at the end of the day. 3. The client complains of an increase in vaginal discharge. 4. The client says she feels pressure against her diaphragm when the baby moves. The correct answer is 1. Correct. Abnormal finding could indicate gestational diabetes, GDM, hazard of placental insufficiency. A nurse is caring for a 37-year-old woman with metastatic ovarian cancer admitted for nausea and vomiting. The physician orders total parenteral nutrition (TPN), a nutritional consult, and diet recall. Which of the following is the best indication that the patient's nutritional status has improved after 4 days? 1. The patient eats most of the food served to her. 2. The patient has gained 1 pound since admission. 3. The patient's albumin level is 4.0 mg per deciliter. 4. The patient's hemoglobin is 8.5 grams per deciliter. The correct answer is 3. Albumin levels are best indicators of long-term nutritional status. The nurse is caring for clients on a medical, surgical unit and determines that several situations need to be addressed. Which of the following situations should the nurse attend to first? 1. An angry daughter is threatening to sue the hospital because her confused mother fell out of bed during the previous shift. 2. The nursing assistant is 30 minutes overdue from a dinner break in the cafeteria for the 3rd time this week. 3. The physician calls the unit to ask the nurse to obtain a client's latest serum electrolyte results from the lab. 4. The husband of a client reports to the nurse that his wife's nose began bleeding after she returned from radiation therapy. The correct answer is 4. Should assess client to determine amount and cause of bleeding. A woman is admitted to the labor and delivery unit in a sickle cell crisis. Which of the following nursing actions is the highest priority? 1. Administer oxygen. 2. Turn her to the right side. 3. Provide adequate hydration. 4. Start antibiotics. The correct answer is 3. Adequate hydration is a priority for any client with sickle cell crisis. A client with a peptic ulcer had a partial gastrectomy and vagotomy, Bill Roth I. In planning the discharge teaching, the client should be cautioned by the nurse about which of the following? 1. Sit up for at least 30 minutes after eating. 2. Avoid fluids between meals. 3. Increase the intake of high carbohydrate foods. 4. Avoid eating large meals that are high in simple sugars and liquids. The correct answer is 4. Basic guidelines to teach a postgastrectomy client are measures to prevent dumping syndrome, which include, lying down for 30 minutes after meals, drinking fluids between meals, and reducing intake of carbohydrates. The nurse is assigned to work with the parents of a retarded child. Which of the following should the nurse include in the care plan for the parents? 1. Interpret the grieving process for the parents. 2. Discuss the reality of institutional placement. 3. Assist the parents in making decisions and long-term plans for the child. 4. Perform a family assessment to assist in the planning of intervention. The correct answer is 4. Assessment. This will help the nurse to know where the family is in regard to grieving, coping, etc. The nurse should explain to a client that tolbutamide oronase is effective for diabetics who 1. Can no longer produce any insulin. 2. Produce minimal amounts of insulin. 3. Are unable to administer their injections. 4. Have a sustained decreased blood glucose. The correct answer is 2. Oral hypoglycemic agents are administered to type 2 non-insulin dependent clients who are able to produce minimal amounts of insulin. A woman at 38 weeks gestation comes to the emergency room with complaints of vaginal bleeding. Which of the following statements, if made by the client, would suggest to the nurse placenta previa as the cause of the bleeding? 1. I feel fine, but the bleeding scares me. 2. I've been more nauseated during the past few weeks. 3. The bleeding started after I carried 4 bags of groceries. 4. I've been having severe abdominal cramps. The correct answer is 1. Placenta previa is characterized by painless vaginal bleeding. The nurse is caring for an 80-year-old client with Parkinson's disease. Which of the following nursing goals is most realistic and appropriate in planning care for this client? 1. Return the client to usual activities of daily living. 2. Maintain optimal function within the client's limitations. 3. Prepare the client for a peaceful and dignified death. 4. Arrest progression of the disease process in the client. The correct answer is 2. Irreversible disease that leads to permanent physical limitations. When using restraints for an agitated, aggressive patient, which of the following statements should not influence the nurse's actions during this intervention? 1. The restraints, seclusion policies set forth by the institution. 2. The patient's competence. 3. The patient's voluntary, involuntary status. 4. The patient's nursing care plan. The correct answer is 3. The need for restraints is based on patient's behavioral status and condition, not the patient's voluntary, involuntary status. A 12-year-old boy injured his right knee yesterday during a soccer game. He is brought to the outpatient clinic by his mother. His right knee is painful, swollen, and bruised. During the interview, the nurse learns that the boy has hemophilia A. Which of the following medications would be best for this patient? 1. Oxycodone terephthalate Percodan. 2. Ibuprofen Motrin. 3. Enteric-coated aspirin. 4. Codeine phosphate Poverol. The correct answer is 4. Analgesic used for moderate to severe pain. The parents of a 1-month-old boy bring their son to the clinic for evaluation of a possible right dislocated hip. If a diagnosis of unilateral dislocation of the right hip is made, which of the following symptoms will the nurse observe? 1. Limited adduction of the right leg. 2. Uneven gluteal fold and thigh creases. 3. Increase in length of the right limb. 4. Internal rotation of the right leg. The correct answer is 2. Folds and creases will be longer and deeper on affected side. The nurse is administering terbutaline, Brethine, to a client in labor. Prior to administration of the medication, the nurse assesses the client's pulse to be 144. The nurse's priority action should be to 1. Withhold the medication. 2. Decrease the dose by half. 3. Administer the medication. 4. Wait 15 minutes, then recheck the rate. The correct answer is 1. Maternal tachycardia is a side effect of Brethine. Other maternal side effects include nervousness, tremors, headache, and possible pulmonary edema. Fetal side effects include tachycardia and hypoglycemia. Brethine is usually preferred over ritodrine Utopar because it has minimal effects on blood pressure. The nurse is supervising the staff providing care for an 18-month-old hospitalized with hepatitis A. The nurse determines that the staff's care is appropriate if which of the following is observed. 1. The child is placed in a private room. 2. The staff removes a toy from the child's bed and takes it to the nurse's station. 3. The staff offers the child French fries and a vanilla milkshake for a mid-afternoon snack. 4. The staff uses standard precautions. The correct answer is 1. Contact precautions required for diapered or incontinent clients. The nurse is preparing to administer an injection of haloperidol decanoate Haldol-D. Which of the following actions by the nurse is most appropriate? 1. Massage the injection site. 2. Give deep IM in a large muscle mass. 3. Use a 2-inch 25-gauge needle. 4. Administer the medication in divided doses. The correct answer is 2. Medication is very irritating to subcutaneous tissue. The nurse is monitoring a client's EKG strip and notes coupled premature ventricular contractions greater than 10 per minute. The nurse should expect to administer which of the following? 1. Atropine sulfate, atropine, IV. 2. Isoproterenol, isoprel, IV. 3. Verapamil, kaolin, IV. 4. Lidocaine hydrochloride, xylocaine, IV. The correct answer is 4. Correct. Lidocaine is the drug of choice for frequent premature ventricular contractions (PVC) occurring in excess of 6 to 10 per minute, for coupled PVCs or for a consecutive series of PVCs that may result in ventricular tachycardia. A client with newly diagnosed type 1 diabetes mellitus is being seen by the home health nurse. The physician orders include 1,200 calorie ADA diet, 15 units of NPH insulin before breakfast, and check blood sugar QID. When the nurse visits the client at 5 p.m., the nurse observes the man performing a blood sugar analysis. The result is 50 mg per deciliter. The nurse would expect the client to be 1. Confused with cold, clammy skin and a pulse of 110. 2. Lethargic with hot, dry skin and rapid, deep respirations. 3. Alert and cooperative with a BP of 130/80 and respirations of 12. 4. Short of breath, with distended neck veins and a bounding pulse of 96. The correct answer is 1. Symptoms of hypoglycemia, normal blood sugar 70 to 110 mg per deciliter. That's it with this video. Check out the website for more free nursing test bank questions. Thank you for watching.